So welcome to those of you watching on the recording. You're joining us for the Community Action for Health and Wellbeing webinar. We're really excited to have a wonderful audience with us this evening on Zoom and three incredible speakers. Simon Sherbersky, Jane Pighting and Brendan Martin are all going to share short presentations with us this evening on the topic of community action for health and wellbeing, and then we're going to have breakout room discussions and a kind of question and answer session too. So the first speaker that I'm going to introduce this evening is Simon Sherbersky, who is the lead officer at Torbay Community Development Trust and the director of Ageing Well Torbay. Simon is a positive change agent, so he's really focused on strength-based approaches to improving lives by treating everyone as a valid contributor, connecting people around their passions, their skills and their interests. So we're really excited to hear from Simon this evening on the topic at hand. Simon, I'll invite you to unmute yourself and then I'll hand over to you.
Hello everyone. So I'm Simon. And before I go any further, I just want to let everyone see the image behind me. So thank you to the Sandman, who does sand art, sand sculpture in Torbay. We asked him to do this to say thank you to all the people who've given kindness and time to support their fellow neighbours and other humans in Torbay. We turned it into a postcard and sent it to every volunteer who's helped through the crisis. So I think after thanking all the people who've given so much in the recent couple of months, I should also say thank you to the National Lottery Community Fund for giving us the flexibility to shift our approach to deal with a crisis. But before I talk about what we've done in being responsive to the crisis, I just want to tell you a little bit about what we were up to before then. So I think we've got probably one of the largest asset-based community development programs in the country. We have 15 community builders. I think there might be one or two on the call. And a huge thank you to you. The one stat I want to share from the independent evaluation of our work of 5 years working in the neighbourhoods of Torbay is that people's ability to use their skills and expertise to benefit their community has more than doubled from 23% to 56%. And most of the people that we're talking about are people who were previously isolated or lonely people over 50. We've got lots of other amazing statistics. And I think what we've managed to do over 5 years is to prove that asset-based community development is a powerful tool to create community well-being. I'd also like to say a huge thank you to all the people who've contributed since the 16th of March when we set up the Torbay Community Coronavirus Helpline. We've had offers of support from other voluntary groups and organisations, from a whole range of people, from colleagues in the NHS, in children's services, and support from local businesses. I think from a community development perspective, what's happened in the coronavirus crisis has been, for someone who believes passionately in community development, has been like all my Christmases came at once. I don't mean to sound enthusiastic about the crisis, there's been a lot of terrible things to do with it, but from a community development point of view, it's enabled us to harness the kindness and the community spirit within Torbay. So our asset-based community development team of 15 community builders has been working within what we call the social prescribing ecosystem for the last 5 years, with colleagues from Age UK and others, wellbeing coordinators, and so many more. But I want to talk a little bit more about what's happened since the crisis, the coronavirus happened, because actually what's happened has been something really magical and amazing. So our model is to harness the kindness in all of us. And that's the way we've approached dealing with the crisis that presented itself to us. So on the 16th of March, we created a helpline. It was well publicised and communicated by our excellent communications team. It was open 7 days a week from 8 till 8 and staffed initially by our staff and then joined by lots of others. We've taken over 12,000 calls and supported 5,000 people in need of a range of supports. As we went along, we built a system, and we couldn't have done any of this unless we had the resources within our organisation and those of other partners. So we've got a rapid response team, initially made up entirely of our community builder team, who went above and beyond to help people who couldn't come out with shopping, with prescriptions. The most interesting request we've had, and I'm not sure we managed to find a match for this one, was, could someone please come and deliver my puppies for me? Bit challenging with the distancing issues. So we had a rapid response team up and running from day one, dealing with emergencies. I haven't got any food, I need my prescription now, and so on, while we built the rest of the system. So we had a referencing team. We don't do DBS checks. We thought that would take too long, and it doesn't really tell us anything anyway. So some of our staff have been referencing something in the order of 700, 800 volunteers. And then we have a matching team. And the matching team is all about matching a request to an offer as close as possible geographically. So it's a neighbour supporting a neighbour. And then what's actually happened is they've often become friends. So actually, rather than it being formal structured volunteering, we did it within the principles of our asset or strength-based approach. And we've matched hundreds of people and supported thousands of people with their requests. What we're moving on to now is about launching our Good Neighbour scheme, where we're encouraging people who would like to coordinate support in their street. And our community builders are starting to support 53 people who've already expressed interest, and we hope there'll be more. So what we hope for in Torbay is that every street is coordinated and neighbourly. Everyone knows their neighbours and look out for each other. And what a lovely place that would be if every neighbourhood felt like that. As we went along, the nature of the calls shifted and changed, and we started to get less calls around shopping and prescriptions and more complex calls coming through the helpline around mental health, around financial advice and so on. And the appetite to come together and work in partnership is like nothing I've ever seen before, which is why I feel like it's all my Christmases come at once. All the advice agencies in the voluntary sector came together. They meet weekly. We triage through the helpline on a daily basis. And there's triage to whoever's got the expertise and the capacity to support people with benefits and other financial support. We now have a 4-tiered system for mental health support. I'm running out of time already. We also helped 12 independent small food banks to come together into a food bank alliance. I think what I want to say is actually you can't really deal with this on a national level. So if I give an example, NHS responders, 1,000 people offered to help in Torbay and only 35 have been actually utilised. So my message to everyone is actually if we want community wellbeing, we have to do it on a local basis. We have to build on the strengths and the assets of our communities. And I've got one final plug, because I think we need a social movement around this. And today I received a link to /Together Coalition. It's together.org.uk. A new movement has been created to build a positive narrative about togetherness and hope, increase participation in activities that bring people together, and build a movement to argue for policy change and practical action needed to build a more connected society. I signed up today and I invite all of you to sign up too. And maybe we might actually make it a better world for all of us, the other side of recovery. Thank you.
Thank you so much, Simon, and for that call to action as well. And just to let everyone know, we will send a follow-up email with any links mentioned from the speakers. Feel free to share links in the chat as we go along to the speakers or anyone equally in the audience. But we'll also make sure that you get any links or calls to action in the follow-up email. So thank you again, Simon, for that really lovely summary, and yeah, really inspiring to hear how people have been working together so much more during this time of crisis and need. So next we're going to hand on to our next speaker, Jane Pighting. So Jane has experience across the public, community and private sectors. So she's worked as a social worker before taking up organisational roles in the NHS, and she's really described as a systems convener, so bringing together networks and conversations across the landscapes of health and care. And we're really excited to hear what Jane has to share with us this evening. So I'll hand over to you, Jane.
Thank you. Just right. So my thinking today was, as the country gears up to a post-COVID normal, whatever that might be, it wasn't clear to me that we are post-COVID, or that the concept of a normal is that useful to us. And I'm sure that I've stood here before in an aftermath, in an unplanned pause, and where people have said, this time it's going to be different. I think there was a similar sort of feeling after 9/11. I think when the Icelandic volcanoes erupted and air travel was disrupted for a significant amount of time, it felt a little bit like this. But that didn't happen. So how can we do it differently this time? How can we build it back together? So Simon's described the experiences that we've had about neighbourhoods stepping up and stepping in, and doing things together that statutory sector could not do. And one of the most ironic things that I've experienced during the COVID is that this wasn't a period of social distancing for me. It was a period of physical distancing, but a period of social unity. And I think that's something really key to notice. So in statutory services, I think we've struggled to balance the tension between our wish to provide really person-centred support in health and care, and a wider recognition that health is actually social. And ego to eco is a phrase that I've heard quite often recently. And I think as we grow to accept that our health is individual and community, it's also about the health of our wider environment and not separate from it. And again, maybe that's a useful thought to take with us. However, I don't think there's a real dichotomy there. I think that's a false dichotomy. I don't think it's individual or community or environmental, but it's all of those things simultaneously. And what I would invite us to do is take a look back at John O'Brien, and one of the originators of person-centred planning, who I think would say, at worst, his work was plagiarised by people working on behalf of the statutory health and care sector, and at best it was turned into a process and some products that could be sold, trained about and measured, and it became a pastiche of what he originally intended. And if we look back at his work, I think we can rediscover the power of that approach. O'Brien says that when person-centred planning is powerful, it gathers to affirm a person in their interdependence and awakens those engaged in their mutual presence, wonder and plight. The collective awakening demands and guides action as people take time to facilitate expressions of higher purpose, recognise possibilities and coordinate commitments to move towards a better community future. And I think recently that COVID experience has brought statutory and community, charitable and for-profit sectors closer together. The boundaries are blurred, and that offers us a significant opportunity to connect around individuals and find that higher purpose in the work of uniting, in a way that John describes it as parting the veil of indifference and allowing a felt sense of that person's identity and higher purpose to move our collective will. So for me, person-centred is at the same time community-centred and even globally centred. And my second point is around community playing a really vital role in supporting health and wellbeing, but it is too small to create the whole systems change that we need in order to make the old system obsolete. If we really want to take the best of what we've learned to move forward, we need to create a system where we join together. Otherwise, we're going to move into our little survival community bubbles, and I really don't think that's what we want. We need to create connections, to synergize globally, and to regenerate the ecosystem that meet human needs at scale. So this is a big piece of work, and we can only do that if we're going to connect in a way where we can create a livable planet that works for everybody. So we need to create communities of learning and networks such as the Network of Wellbeing, because they've got a really vital role to play here. So if we think about the pro-social movement, that describes how traditionally altruistic individuals are eaten up by self-interested individuals. They don't stand a chance against that traditional competitive kind of attitude. However, it also argues that altruistic and collaborative groups eat up self-interested groups. The time is now, I think. We need to move from that traditional competitive mindset and adopt a collaborative one, both within and across our communities. Then we can share our learning, ground our activities in applying our new knowledge. And these groups that develop these relationships and share with other groups, they're going to create their own evolutionary shift. They're going to be the catalyst that drives that progress. They're going to spark an evolutionary connection. My third point is that I don't think it's enough to recognise that things are not working, or just to note that we've discovered something really powerful in communities during the crisis. We need to keep that momentum. We need an organising principle. So some people assume that evolution is a slow process, and that can be the case. But it's also the case that when the conditions are right, we can make a quantum leap. A quantum leap is possible. So Gaudi said, "Nothing is invented, for it is written in nature first." And when we think about the increasing complexity of the challenges that we're now looking at, we can look to complexity science, look at biology and physics to inform our responses. And there's a really lovely new film that's just come out, and I'll put that in my notes that I'll attach into the chat thread. So the more complex the challenge, the more diversity we require to generate a successful response. And when we apply this thinking to wellbeing in communities, I think we also need to remember that neighbourhood does not necessarily provide a community. Some people are stigmatised, they're excluded, and they're even abused by their neighbourhoods. And their nurturing community might not be defined by their physical location. So our challenge when we're thinking about this, and I think we're feeling this now, is to value and enable every individual in their own diversity. So when dealing with complexity, the most effective form of response is actually self-organisation. When we look at complex systems and networks, despite the intrinsic unpredictability, a pattern of recognisable behaviours will emerge when local factors interact. So in order to support that emergence, what we need to do is provide a scaffolding, not rigid structures. We don't need to control things tightly. And this is not a cookie cutter way of working. We can't provide a blueprint that's going to work in every case for every organisation. What we can provide is stepping stones to a new way of being and doing. So as professionals and as community leaders, what we need to do is walk alongside people, helping each group and organisation to find their own path into a connected future. We can't map it out for them. So my 3 takeaways: rediscover a real person-centred approach to work and connect around that higher purpose for each individual. Recognise the possibilities, coordinate the commitments, and move towards a better community future. Number 2, form groups and communities that adopt a really generous growth mindset and reach out to other collaborative communities and organisations. And maybe one of the groups could be the one that Simon just let us know about just previously. And then create these stepping stones, create the capacity to work with complexity by walking alongside these groups and organisations and taking them towards self-managing systems, which I think is maybe a great place to hand over to Flo and invite Brendan to take over.
Thank you so much, Jane. Yeah, really insightful talk there, covering a lot of really, really valuable points about the way that we can approach community development processes in this time and moving forward. Yeah, lots of food for thought. So like you say, we're going to hand over next to Brendan Martin. Just to mention to everyone, we will have a kind of Q&A for Simon, Jane and Brendan at the end, but if you kind of have thoughts or questions that are emerging for you as you're listening to them, feel free to pop them into the chat box. My colleague Roger is keeping a close eye on any questions that emerge, so feel free to share those as they come to you. And I'll hand over to our third and final speaker this evening. Oh, and just to say, yeah, thank you so much, Jane. Jane has shared her notes from her talk, which has got some really useful links in, and again, we'll make sure to include that in the follow-up email. But yeah, to hand over to our final speaker for this evening, Brendan Martin. Brendan leads Buurtzorg Britain and Ireland, which is a social enterprise, which is a partnership between Public World, which is a social enterprise that he founded himself, and Buurtzorg Nederland, which is the groundbreaking Dutch social enterprise that has really revolutionised care at home in the Netherlands. And Brendan's looking at ways to bring that model and the lessons that model has inspired over to the UK. So looking forward to hearing what Brendan has to share this evening. I'll hand over to you now, Brendan.
Thank you very much, Flo, and thank you to Network of Wellbeing for the invitation this evening. Buurtzorg is the Dutch for neighbourhood care, and the name of a social enterprise started by 4 nurses and their friends in 2007 that has now grown to more than 10,000 nurses and nurse assistants in more than 900 self-managed teams, and they between them have reinvented home care in the Netherlands. It lives up to the name neighbourhood care in 2 ways. One is that the teams operate at neighbourhood level, ideally 1 team for a population of around 10,000, but a recognisable neighbourhood, although some have larger patches, particularly to begin with. And each supports around 60 to 70 people. Buurtzorg calls those people clients at any one time. The teams provide holistic care, cutting across the health and social care boundary to do what is needed when it's needed. The second way in which it lives up to that name is that the teams work to enable their clients to live lives that are as meaningful as possible in whatever the circumstances. And indeed, that's how Buurtzorg defines its purpose, rather than its purpose being to provide care. Starting with what matters to the people that Buurtzorg supports and working to mobilize and build their own capacity for self-care. But they also mobilize and build a capacity of potential supports around their clients, family, neighbors, the wider community, with the aim of supporting more self-caring neighborhoods. In this way, the independence of the clients is optimized by strengthening the interdependence of communities. So this is an approach to health and social care that's based fundamentally on strengthening relationships between the client and the professional, and within families and neighborhoods. And this is done by harnessing the professional and vocational expertise of professionals in support of the self-knowledge of clients and their communities, rather than replacing or undermining those assets. Building relationships of trust is at the heart of the approach. Trust between the professionals and the people they support, between the professionals themselves in their self-managed teams, in which there is both support, mutual support and challenge, and between those teams and their organization, which has the role not of controlling or commanding them, but of serving and supporting them. And above all, to build trustful, self-caring communities. So there's a continuity and a consistency of logic behind this, from the relationship between the professionals and their clients, right through to the way in which the back office supports those professionals. All the way through, the practice is to listen well, discuss and reach a shared understanding of what's needed, and to do it. Whether that be a nurse providing a morphine drip to enable somebody to die at home if they wish, that same nurse helping somebody to have a shower or to prepare their lunch if necessary, to the back office providing effective personal protective equipment and regularly updated information to the teams so that they can adapt as necessary in the COVID crisis, which is exactly what Buurtzorg has done with great success over the last 3 months. The results of this in the Netherlands have been, firstly, great care and support to the people receiving care, around about 100,000 people per year now. It's the biggest provider of home care in the Netherlands now. Secondly, very satisfied and happy staff, as well as Buurtzorg having maximum results in the inspection by the equivalent of the CQC in the Netherlands last year. Buurtzorg has won Employer of the Year in the Netherlands across all sectors of the economy in on six separate years. And thirdly, doing all this at less cost. And that's possible because the way of working that I've described, supporting the self-management of care, developing and building the capacities of individuals and the communities around them, means that the number of hours of professional input has been able to be reduced. In fact, it's fallen by half since Buurtzorg began in 2007 to the number of hours per client on average today. And above all, the results are also stronger local communities with professionals on tap, but not on top. Now, our system, of course, and our structures and institutions are different in some ways from those in the Netherlands. And in the work that we've been doing to support NHS, local government, and social enterprise and charitable organizations to learn from the Buurtzorg experience over the last few years, of course, we've come up against those differences. But that's not stopping us trying to learn from that experience how to bring the same approach to Britain, because we believe in the universality of our ethos, which is summed up in the phrase, humanity before bureaucracy. Thank you.
Thank you, Brendan. And what a powerful phrase to end on, humanity before bureaucracy. So thank you to all three of our speakers, Simon, Jane and Brendan, for that that range of perspectives on the ways that we can engage in this time, the ways that we've seen community development happen in this time and the lessons that we can learn. We would love to hear kind of questions and have a discussion with the speakers, but before we move towards that, we're going to go into breakout rooms so that you guys can talk to each other. So you'll be moved to a room of about 4 or 5 people, and I'll invite you to share with each other on 3 questions which I've just popped in the chat box, so you can either make a note of them or take a screenshot now before we go into the room. So the questions are introductions, so just introducing yourself, getting to know the people in your room, where you're from, and the 2 kind of core questions are you actively involved in health and wellbeing work in your community, and what does the new normal mean to you in relation to community wellbeing? So Jane touched on this idea of normal, and you know, this phrase, the new normal, has been thrown around a lot, but what does that mean to you? Do you think it's useful or not? Just kind of reflecting together in your groups. Oh, sorry, that was the time warning, but Brendan, you kept the time so efficiently. So when we come back from the breakout rooms, we will have Q&A discussions with the speakers. So do feel free to kind of reflect on what's been shared by the speakers in the discussions you have in the breakout rooms, but hopefully you've all had the chance to note down those questions now. So you'll see a box pop up and appear to invite you to go to the breakout rooms, hopefully now. And I'll give you a warning when we've got a few minutes before coming back. You'll have 10 minutes or so in total, 10 or 15 minutes. Hope you enjoy the discussions. And for those watching on the recording, I'm going to pause the recording now, but feel free to join us live in future. We'll restart the recording, so welcome back for those joining us on the recording too. So now we're gonna, after that breakout room discussion, which I hope you all found valuable, looks like you did from the thumbs up, we're gonna move on to the Q&A section of our time together this evening. My colleague Roger has been keeping an eye on the chat box throughout the event to kind of summarise any questions that have been coming in, but feel free to add more questions that you have for the speakers, and feel free to say if it's for a particular speaker, from Simon, who spoke first, Jane second, or Brendan third. Yeah, feel free to add extra questions in the chat, but I'm going to hand over to my colleague Roger to summarise maybe 1 or 2 of the first questions or topics that are coming up. I'll unmute you, Roger, or maybe you could unmute yourself. Thank you.
Okay, welcome everybody. Thank you very much, Flo. Apologies for the wait while I unmuted myself. We've actually only had 3 questions, but they're really good questions. So feel free to throw in a few more. The first one is from Deirdre of the Mid and East Antrim Age Well Partnership, and that's for Simon. And she mentioned you mentioned thanks to the lottery, Simon. Has your group received funding supported by other statutory organisations such as council, police services, health services, and so on. And Deirdre also asked Jane that partnerships and collaboration is what this is all about, but many of the local statutory organisations in Northern Ireland talk about co-production, where the third sector is supposed to compete for tenders to do work. That's not really very collaborative. How would you recommend that she challenges this? There's 2 questions there for starters.
Great, thank you, Roger. So we'll hand over to Simon for that first question there, and then go over to Jane for the second one.
Well, I'd actually like to respond to both, if I may.
Okay,
but, so the first one is, I'm hopeful, although Torbay is not a particularly rich place when it comes to statutory agencies, but we are in conversations with them. We have been funded in the past by both health and the council, not so much by police. We're not really currently, little bits and bobs. But I think because of what's just happened, our relationships and appetite for partnership working with the council and others, I think a lot of my time is going to be spent trying to secure funding from our statutory partners. I really agree with the second point there for Jane. It's been a real bugbear of mine. We've been testing collaborative commissioning within our Ageing Well partnership with the lottery funding. And we've demonstrated it works much better to bring voluntary organisations together in partnership. And I think we're going to see much more of that in Torbay. It's certainly been recognised. Thank you.
Thanks, Simon. And handing over to Jane to add to that.
So, yeah, I did some work in Northern Ireland a couple of years ago around different ways of providing care. And I think what I noticed about the commissioning departments, that the commissioning personnel was a kind of anxiety, like a risk aversion. It was all terribly interesting, the stuff that I was telling them, but I'm not sure that they were really up for it, because maybe it sounded a bit too unusual and risky. And I think that's part of the attitude that you get from statutory services, is like, you know, well, that sounds great, but it's my head on the block. And sometimes I think people's identity, their professional identity, and the way that they view their competence, and the way that sometimes we decide to evaluate their competence, is that they're meant to know everything. So I think some of this is about creating spaces where we can learn together and make mistakes together, because if we're going to be really innovative and exciting, all of the stuff that we're going to do is not going to work. And I think that's something that we need to accept up front. Yeah, if you really are being innovative, you will expect to see quite a few failures around you. Otherwise, you're not really being innovative, are you? You're just doing the stuff that you knew would work in the first place. And the other stuff that I think you can do is take the lead. So there's an organisation called the Equal Care Co-op who hangs out up in Yorkshire. And when faced with this kind of scenario where they were expected to bid to provide services, they said, okay, fine, well, if that's the system that we need to use, that's fine, but we're going to do that on Google, totally open. We're going to involve all of the people that we support, we're going to involve all of our staff and our community, and any of our so-called competitors who want to have a look at the bid that we're putting in, here it is, you have a look, it's all here. And that really changed the dynamic of that conversation. So again, if those are the rules, those are the rules, but maybe you can work with them in a way that makes those rules less meaningful or less impactful, so you can create that collaboration yourself.
Yeah, thanks very much, Jane. That's really helpful. Over to you, Roger, for further questions.
Yeah, a couple more. Nick Garrett from, it's funny, I always end up getting a question asked before I connect with somebody in my breakout group. I connected with Nick, a really interesting organisation called Knaresborough Connectors in Yorkshire. His question directed at Simon, but again, feel free for those to pop in. ABCD encourages people to share their gifts to benefit their community, so they're seen as needed, not needy. How did you achieve this with the people who were shielding? That's the first question. Second, before you get in there, Simon,
that's a devil question.
It's a devil question, but I want to get an answer to it. Joanna, a really interesting question. She said, the worst thing we can do is to waste a crisis. How can we think boldly about creating a new normal? And that's for everybody.
Thanks, Roger. So over to Simon for the first question, first of all.
Do you know what? There's people on this that probably could answer that question better than me. On my screen, I can see Marianne Parker, one of our community builders, and Ursula Garrettley. The answer is our biggest challenge is that we've had to shift a strengths-based model to support people in a crisis. And actually that creates dependency, as you've already said. And so we're trying to come up with creative ways to actually address that. We have had some people who've been shielded who then had help and then offered help to others. So we have had some of that happening. But we're thinking very creatively, at least our community builder team are, about how do we actually help those people to get involved and being active contributors rather than passive recipients. So it's a big challenge. One very quick example, I know in one small street area, people are all coming out and having coffee mornings in their back gardens as a way of connecting. I've heard in another area in Torbay, they didn't have back gardens, so they've approached the local hotel, which is currently closed, and they've actually given them access to some of their grounds so people can meet up and connect with each other. But it's those kinds of creative ideas that I guess we're exploring at the moment.
Yeah, thank you, Simon, and thanks for mentioning. Yeah, we've got like such a rich audience here this evening, and if people have comments or to add to the speakers' responses, feel free to share in the chat, because it's really great to have this learning space together. But we're going to move on to the second question that Roger raised there. So how can we think boldly about creating a new normal, Johanna asks. So I think I'll hand first over to Brendan and then Jane, and then if Simon wants to add anything on that question. So Brendan, how can we think boldly about creating a new normal?
I would say there are two things that I've noticed. One is that, as everybody's been describing this evening very richly, there's a huge energy and the creation of loads of knowledge and understanding about how communities can care for themselves more effectively has grown out of this crisis. And not just the experience, but real knowledge has been created, and let's not waste that. Secondly, many professionals, whether they be nurses, social workers or housing workers, police officers perhaps, teachers, have had to find new solutions to unprecedented problems, not necessarily supported by their organisational leaders, certainly not necessarily supported by their local government, although sometimes very well supported by local government, and let's face it, definitely not supported by national government. So if we can encourage I would say, the more we can see relationships developing between those community organisations and the professionals themselves, not necessarily through their organisational leaders, but reaching out to each other to build a movement, because we're up against a government nationally that is hopeless at mobilising this knowledge. It doesn't even understand where the knowledge is. But I think a lot of understanding at community and local level about how to mobilise knowledge together to create new solutions. So I think that's where the energy is. And that's what certainly we're hoping to contribute to doing. And that's what makes me very excited, because actually I'm very optimistic, because I think despite all the obstacles, there's a tremendous opportunity here to build something really new.
Yeah. Thank you, Brendan. And Jane, would you like to add to that? Oh, I think you're still muted, Jane, sorry.
That wouldn't help, right, okay. So, yeah, I'm not sure I like the concept of a new normal, because for me, that's kind of, it's saying that it's static, it's saying there's a thing about sameness about it. So if there is a new normal, I'd like it to be that normal isn't normal. I think there's this thing for me about diversity. There's a thing for me around constant learning, and there's something about us accepting the constant change, the constant evolution, and developing our capacity to work with that and actually embrace that. Because I think that's the key to being able to respond to whatever happens next. Because whatever happens next isn't going to be what just happened, and isn't going to be what was before. So, I know there's a real kind of longing for going back to this state of being really confident and being really sure about what things were. But I'm not sure if that was that really what was happening before for lots of us. So yeah, so at the risk of being really annoying, let's ditch the concept of normal and embrace the idea of welcoming and working with whatever's to come.
Yeah, thank you, Jane. Yeah, I think yeah, this framing of the new normal is something that we can kind of critically assess rather than accept. I know Roger, my colleague, has talked about the new not normal, and there's lots of different kind of framings around, yeah, kind of questioning what is the normal. Do we want to kind of go back to this idea of normal? So yeah, really interesting comments. Simon, would you like to add anything on that question before we move on?
I don't want to ever be normal. Actually, that's my answer. And in terms of the bravery, I'll quote the motto of a fantastic strength or asset-based community group in Torbay. Big shout out to Bricks and Yes. Their motto is just do something. You know, one of the problems with, you know, top-down professionalised bodies is they're kind of stuck the whole time because they have to get it right, someone said earlier. But actually what I've seen is an appetite to do things differently on a level I've never seen before in Torbay. And we're going to grab it. And we're going to work with all those people and build the relationships. We're now trusted enough for them to listen to us. And that's what we're going to grab hold of. So we're going to jump in and make some dramatic changes and all work together for one Torbay. That's what we're going to do. Jump in and just do something.
Yeah, great invitation, Simon. Thank you. So I think we've got time for one, possibly two more questions. So Roger, I'll hand over to you to see if there's any more coming in.
Okay. Well, the person who's been really, really good at questions again is Deirdre from Northern Ireland, who's got a question for Brendan, so sort of levelling it out a bit, which is great work. How does your work go beyond the norm health perception and use the social determinants of health to tackle the health inequalities that are now more visible and have been increasing due to COVID-19? So there's a thing about, and maybe I can add to this, how do we make sure working communities that we involve everybody in the asset-based approach and maybe get out of some of the more middle-class areas into areas that are more, a greater variety of different areas in our communities to make sure that everybody benefits?
Wow, what a question. I only know a bit of the answer, but I'll offer what I do feel like I understand. The solutions, and one of the reasons I hate the expression "new normal" is that I think it tends to remove our agency from whatever comes next, as if there is some definition of new normal, and so it's really a question of finding some solutions within communities, which is one of the reasons that one of the things I've learned over the last 3 or 4 years. I came into the work that I'm doing now through many years of working with public service organisations, and what I've learned more and more is actually where the energy is that the professionals need to mobilise is in the communities themselves. But these are very unequal communities, communities in which, I mean, I live in Islington in London, for example, where there is a real divide between working class communities and middle class, very much safer communities, and where we have a real job to do to find ways to build, to mobilize the, if you like, the assets that are available amongst a lot of people who've got real advantages, and make those assets available to others. And the only way it seems to me that's going to happen is for people in middle-class neighbourhoods like mine to understand that the real assets of community building are there in other parts of the communities that they don't touch. So this concept of, instead of offering what we can offer and what we think we should be offering, but looking for support from others and seeing where the knowledge, the understanding is available, which is where I think if you connect up the COVID crisis with the Black Lives Matters movement, it's very obvious that this government doesn't understand either the knowledge that is available in our society, in communities and amongst frontline professionals in public services, or the knowledge about inequality in those communities. So I think for me, it's a question of really getting to where the understanding and knowledge really is in a humble way. And I think that's the job of public service organisations. And that's the approach, that's the best answer I can give, I think.
Thank you, Brendan. That's really helpful and definitely an important issue. I'm thinking maybe we've got time for one last question, and then what we're going to do is hear a kind of final word from each of the speakers of kind of a takeaway or a suggested action that they'd like you guys to take away from this evening. And then we're going to close by sharing some other opportunities for events and discussions that you are welcome to join. But Roger, before we move on, is there a final question you would like to share?
There isn't from the audience, unless anybody wants to throw in one very, very quickly. But I guess the one that springs to my mind is this morning I was at looking at a seminar from the Joseph Rowntree Foundation that was talking about poverty alleviation solely from the perspective of boosting the economy to create jobs, and with the expectation that most of the jobs being created would be, you know, service jobs in shops and so on. And I was really struck by how much of the debate at national level is very top down and very tends to remove the agency of local communities. And I wondered maybe what the panelists thought of what we could all do together to try and influence that national debate, to make people realise that the power that there is in communities, and not just for improving well-being, but also for creating more employment, creating more better conditions such that everyone's well-being is met.
Okay, who would like to come in on that question from Roger?
I'm actually busy reading the chat and looking at lots of other things that, and I'd actually like to go back to the previous point about inequality, if I'm honest, because I've seen someone there talking about what happened to the man who was murdered and Black Lives Matter, and my wife's a black woman, and we went to a Black Lives Matter kind of event in Torquay last weekend, and I listened to people talking, one young lady talking about how she scrubbed herself in the shower to try and make herself white because she was made to feel, you know, like she didn't matter. And I guess I stood up at the end of that event and I said, I'm a privileged white man, and I feel like people like me need to stand up and be counted. So I feel this very strongly. So since then, I've gone to the council and I'm trying to actually work with the council locally to actually try and actually get institutions and the system to really try and tackle systemic racism in Torbay, at least. That's my area of influence. Sorry, I just wanted to say that because I didn't want those comments to be ignored.
Yeah,
Sorry,
no,
I can't remember what your question was, Roger, sorry.
It was about influencing national government, but we can carry on.
yeah, no, thank you. Thanks, Simon. And yeah, and thanks for raising the topic in the chat. I think it's a really important issue to be raised, and Brendan touched on it in his comments on inequality as well. And it's definitely, obviously, a lot, you know, these kind of, we're in a time of kind of rapid change, and I think that the Black Lives Matter movement, and like you say, the murders that have gone on in the States have been shocking to us all and have kind of pushed a more wider discussion on these issues, which is really important. And I know that one of our partners, WEAL, the Wellbeing Economics Alliance, is going to have an event specifically about the wellbeing movement and Black Lives Matter. I think it's happening next week, but I'm going to include the link in the follow-up discussion because I feel like it's such an important topic to discuss, and I feel like we don't have time to fully give it justice in this event, but of course it's something that we really need to be conscious of, especially in relation to the kind of intersection of inequality, well-being, diversity. All of these issues are so important and have kind of are coming to the fore increasingly at this time. So yeah, if any of the other speakers want to comment on that and the discussion in the chat, you're welcome to, and or on Roger's question, which maybe, but if it's more alive for you to comment on what's been raised, then that's also welcome. Jane and or Brendan.
I mean, well, I just add, I mean, I can't think of a single big challenge that we're facing as a society that is not made worse by inequality of all sorts, and in which the solution doesn't include challenging inequality of every kind, whether it be climate change, where how can you use, for example, the price mechanism to encourage people to use energy more efficiently, if actually that distributes the burden unequally towards people who can least afford it. So that's just one example. There isn't a single challenge that we have as a society, whether it be internationally or very locally, that inequality isn't at the center of it. So I think at national level, the best thing, we need to really focus on that and on how the solution to every single problem we've got can't be found whilst we don't tackle inequalities of all kinds, based on our equalities in every respect, whether it be race, ethnicity, class, or anything else. So all of these things will have to be tackled, and that means not just creating jobs, for example, but creating new sorts of economic opportunities for people. So that's what I would say is the political agenda nationally that would draw me.
Thanks, Brendan. Jane?
Yeah, so I think this is massive and quite exciting, actually, because there's a massive opportunity here to make that leap, to make that evolutionary jump. Because for me, this is it's about the breaking down of either ors. It's about the breaking down of our concepts of black and white. It's about a breaking down of our concepts of man and woman. There's all sorts of stuff that's actually challenging the way that we think and perceive and relate to the world at the minute. And that this is going to be really hard, and it's going to be really, really complex. But I think by actually embracing that and accepting as well, not denying the bits of ourselves that think like this, that feel like this, but by working with that, we can work through that. But this is a huge learning journey, I think, for all of us in all sorts of different ways. So for me, it's not about solving it or sorting it, because it's not something to be solved or sorted. It's about embracing it and working with it. And again, I think that might be a different way to engage with this kind of stuff.
Thanks, Jane, and thank you everyone in the chat box for kind of raising all of this issue and all of the issues and resources and topics that have been discussed tonight. I think one of our intentions of creating these spaces online is to be able to talk and share and connect with each other about what's really going on at the moment in relation to the kind of well-being world and how we're dealing with these issues that we face. And I think a lot of it is about kind of learning, unlearning, relearning, and that we can do that together, that we can support each other and share with each other as part of that process. So really appreciate that happening this evening with each other. So we're gonna have a final word of summary / takeaway action from each of the speakers. Then we're going to share about some future events that you guys can join. And like I've mentioned, we can we'll save the chat box because I know a lot of useful resources and discussion have been shared there, and we'll send that in the follow-up email as well. So there'll be opportunities to kind of further explore. But we'll go around in the same order we did the presentation. So Simon, then Jane, then Brendan. So Simon, any takeaway word?
Yes, I think I just want to make another plug. So I think for me, the takeaway word is together. Together we are strong. Together we can tackle some of these issues that we talked about tonight. And the reason I'm promoting together.org.uk is because I met the lady who's setting it up, who set up the Joe Cox Foundation previously, a lady called Iona Lawrence. So I think if we could get a national movement together, togetherness and community power, let's take the power back away from a government that really doesn't deserve it, in my view. So that's my takeaway. Thanks.
Thank you, Simon. And Jane?
I think there's togetherness, and I think it's about connecting, and it's about connecting all sorts of groups, and not trying to have a cookie cutter or a one or a, you know, this is over here, so let's not duplicate, but embracing all of that, connecting it up, seeing it as a really complex system, and learning to work with that.
Thanks, Jane. And Brendan?
For me, it would be that when we talk about community, that I always have a slight caveat in my mind, which is that communities are not necessarily open or equal communities. They're not necessarily welcoming communities. One of the things I like about the asset-based community development principles, which I'm only beginning to get to understand, is that one of the principles is a welcomeness and openness to strangers. And that, I think, so we have to think about what we mean by community, in a sense, and decide how we want to define it. And secondly, the takeaway for me would be sometimes we hear communities talked about as if communities are an alternative to institutions. But I think what we need is to find ways for institutions to support more effectively the self-organization of communities and to understand that as their role. But we can't do without those institutions. We need to reclaim them, not just ignore them. So I think the relationship between institutions and communities is really important here, because that's also the relationship between interdependency, creating the conditions for individual independence as much as people want that individually. So that relationship between interdependency and independence seems to me to be really important.
Wow, brilliant. Thank you guys for such inspiring talks and giving us so much food for thought. And again, thank you to everyone in the audience for engaging in such an interactive space of learning together. So I want to share 3 follow-up opportunities with you guys now. We're running these webinars every 2 weeks for free, focusing on different aspects of wellbeing and creating learning spaces together. So the next webinar will be in 2 weeks' time, and we're going to be focusing on more closely on personal wellbeing and mental health. The next webinar is going to be titled Compassion for Now, Mindful Approaches to Mental Health and Wellbeing. And we're going to have a few wonderful guests on. Chooks Maxwell is here this evening. He's going to be a guest of ours next time, as well as Dr. Groves from Breathing Space London. So we'll send further details about that. That will be on 2 weeks on Tuesday. And then in addition to our regular webinars, we're also opening up some more interactive spaces to give more space to hearing from you guys in different ways. So we're offering 2 different forms of spaces. One will be a coffee break, which a few on this call have kind of joined before, but now we want to make these coffee breaks, which we've been doing really informally with some close contacts in our network. We just want to open that out to everyone that's kind of joining these discussions. So the idea of the coffee break is just to connect with other people working in wellbeing or really passionate about these issues over a cuppa, and to just share what we're working on, how we're doing, and any ways we can kind of support each other. So we're running those every 2 weeks on a Monday. The next one will be coming Monday the 29th. And again, we'll send the sign up link in the follow-up email. But yeah, that's an open invitation, and it will be kind of more of a friendly, informal space. And not wanting to overwhelm you guys with invitations, but the third invite is to a listening space. So those of you that attend our webinars regularly will know that last time we followed our webinar with a listening space to just offer space for people to hear and hear each other and connect from the heart and share stories with each other on these topics that can touch us quite deeply. And I think it's really important that we give space to listen to different perspectives and to share with each other how things are touching us. So those listening spaces we're running in partnership with a wonderful organisation called the Heart Movement, and again we're going to be running those on alternate Tuesdays for the coming few weeks to our webinars. So the next one will be on the 30th of June, next Tuesday. And I'm going to put the link to, in fact, at risk of overwhelming you, I'm just going to put all three links, and then any of those events that I've mentioned that are of interest to you, you can follow what you feel most enthused about. But yeah, we'd love you to join us at the coffee breaks and the listening spaces and the next webinar, or whichever of those you feel speaks to you most. The links are there in the chat box, and we'll also include them in the follow-up email. So my final invite is just, it's lovely always to have a kind of screenshot of this shared space together, just so that we've got something to share on social media and look back on and remember this time of connection and learning. So if you guys don't mind, I'm going to take a screenshot now. If you'd prefer not to have your face shared on social media, then just turn your camera off, and then you won't be included. And if you're really enthusiastic about being included on social media, then feel free to like wave or smile or make a sign of your choice, and I'll just take a quick screenshot now and you can hear it. Nice. Thanks guys, or give you a thumbs up. Love it, Brendan. Okay, so thank you all so much again. It's been a really interesting and fruitful discussion and place of sharing, and I really appreciate all of the openness that you've all arrived with. And thank you Simon, Jane and Brendan for sharing your wisdom with us this evening, and for all of you for being here. Hope to see you at future events and connect more in future. I'm going to unmute you all so everyone can say goodbye to each other.
Bye.
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 Thanks.
Thank you.
Bye.
Thank you.
Thank you.
Thank
Bye.
you.
Bye.
Bye.
Nice doggy.
Thank you.
Bye everyone.
Bye, Joe.
Bye.
See ya.
Bye.
Bye. Great discussion, by the way.
Thank you.
Loved it.
Really good. Really good.
Bye.
Thank you. Thank you.
Bye. See you at the next one.
Okay, see you, Joe.
Bye.
Bye, everyone.
Bye.
Bye, Ursula.
Bye.
I can't go.
You're here forever, are you?
Yeah. We'll all leave eventually, don't we?
I see Roger's gone, Flo.
Yeah, I'll just stop the recording and say thanks for those listening on the recording. And